I want to introduce our moderator of the panel. Dr. Derrick Ardis is the former COO of Vision Source. He is the managing partner of Artis Consulting, and he is the chair of the Vision Council's Diversity, Equity, Inclusion. So I'm going to turn our attention over to Dr. Ardis as he brings us into Opening Your Eyes, the first look at the Industry Diversity, Equity, and Inclusion Survey. Dr. Ardis, you have our attention.
Thank you, Terrence. Thank you. I'm Derrick Artis, and I'm honored to moderate this distinguished panel of doctors and industry executives that are going to share and discuss the Vision Council's Diversity, Equity, and Inclusion Survey. For those that aren't familiar with the Vision Council is the trade organization for the entire optical industry, representing the suppliers and manufacturers. And the Vision Council's objective is to grow the category of eye care users, wearers, right? And diversity, equity, and inclusion, if you think about it, is key to the Vision Council meeting the objective of growing our category, bringing more people into eye care. And so the Vision Council in 2020, in light of some of the racial unrest across the country, put together a task force to assess diversity, equity, and inclusion in our industry, the optical industry. And I will share with you later some of the folks on our task force. The task force really came up with three goals. Number one, get a baseline understanding of where we are today as an industry with diversity, equity, and inclusion. And so that's what we're going to share with you, the baseline survey that we did. We started the survey in the fall and took a couple months, hired a top market research company, a minority-owned market research company, by the way, and we finished the survey. And so what you're going to see today is our survey results. So the second thing, our second goal was, once we have the survey results, we want to share them and collaborate across the industry. The Vision Council is doing some outstanding work in this area, but as you guys know, the Academy is doing some great work in this area. ASCO is doing great work in this area. The AOA is doing some work in this area. Many of the companies in our industry have hired diversity, equity, and inclusion executives to do work in this area. So we're collaborating, and this is part of our collaborative effort. And then our third objective, in which we will do probably mid to late year, is we're going to come up with recommendations for the industry on what does good look like in terms of diversity, equity, and inclusion in your organization. We'll come up with recommendations as well as rewards and recognition for companies in our industry that are performing very well in diversity, equity, and inclusion. So that's the background on how we got here, and real excited to share with you what the results. We put together for this CE program, this panel of folks across the industry. And so we'll first introduce you to our panel members. I'll start with myself. I'm Derrick Ardis. I'm an optometrist, practiced for 10 years in the Washington, D.C. area, but spent the last 21 years of my career actually in industry in various roles, from J&J and my last 10 years at Vision Source. And so I've been very involved in the industry, but optometry is my heart. And so that's my background. I'll turn it back over to Terrence to give you his background. Terrence is from the Vision Council. So Terrence, and then after you, we'll go with the rest of the panel, okay?
Everybody, I'm Terrence, AKA the Optical Poet. I'm the Director of Partnerships and Programming with the Vision Council. My main role is on the Vision Expo shows, and I also helped manage the internal operations of the DE&I task force. So pretty much I report to Dr. Ardis.
No, not hardly. Terrence is really the key driver behind this entire effort. But I do want to say that the CEO of the Vision Council is a huge advocate for this, and so this is an industry. This is a company-wide endeavor for the Vision Council, and Terrence has done a heck of a job leading it and driving it. So thank you, Terrence.
Thank you, Dr. Ardis. Appreciate it.
All right. Also joining our panel, representing the NOA and NOVA, is Dr. Sherrol Reynolds. Dr. Reynolds?
Reynolds, you might be on mute.
While we sort out Dr.
No, that's okay. I got it. The host had to unmute me, so now I am unmuted. Thank you so much, Dr. Ardis. My name is Dr. Sherrol Reynolds, and I am currently the president of the National Optometric Association, an organization dedicated for over 50 years in addressing and advancing the visual health of minority population. And so diversity, inclusion, and equity for the NOA has been our focus. That's why this organization started. I'm also a practicing optometrist. I'm an associate professor at Nova Southeastern University, College of Optometry for over 20 plus years. I know I look 25, but I've been practicing for a very long time. And the discussion around diversity, inclusion, and equity is very important to me. So I'm really happy to be here to participate. So thank you.
Thank you, Dr. Reynolds. Our next distinguished panel member is Dr. Cynthia Hurd from Southern College of Optometry, representing the American Academy of Optometry. Dr. Hurd.
Good evening. Can everybody hear me okay?
Yes.
Thank you. My name is Cynthia Hurd, like was just mentioned. I am the American Academy of Optometry Diversity Task Force Chair, which has been about a year now since this group was brought together for the NOA. I'm sorry, for the Academy. I completed my optometry degree at Ohio State University. I also did a residency at the Birmingham VA in geriatric and rehabilitative optometry. I've been a clinical educator for 29 years. Yes, and I am 29. I'm currently a professor at Southern College of Optometry, and I'm a past president of the National Optometric Association. Thank you.
Thank you, Dr. Hurd. Our next panel member is Dr. Ruth Shellgate, representing ASCO. Ruth?
Hi, good evening, everyone. So happy to be here on this panel with my colleagues. And I am representing ASCO, the Diversity Cultural Competency Committee, in which we have committed to really working cross-organizationally on the educational side of things to make sure that our students are ready when it comes to taking care of a diverse population of patients. Faculty are ready to teach, them and be comfortable making sure that
Using a little internet connection.
I think we may have lost Dr. Shoge.
Okay, we'll come back to Dr. Shoge. Our next distinguished panelist is Dr. Diana Canto-Sims, and Diana is representing the Vision Council. So Dr. Canto-Sims.
Good evening, everyone. Can everyone hear me?
We sure can.
Awesome. It is such an honor to be with all of you fine people this evening. So my name is Dr. Diana Canto-Sims, and I feel like I've had a passion for diversity, inclusion, and equity even before it was even a thing. My mom is immigrated from Mexico and my dad is from Puerto Rico. So since I was a child, I've been always advocating for them here in the United States. So I am from Chicago. I graduated from the School of Optometry, the Inter-American University in Puerto Rico, Escuela de Optometría. And I currently live in Chicago. And I started a practice with my husband over 16 years ago to be able to serve the Spanish-speaking community here in Chicago that was very underserved. So diversity, equity, and inclusion is a big passion of mine, and it is such a pleasure to be here today.
Thank you, Dr. Canto-Sims. And last but certainly not least is Cristina Lopez from Essilor. Cristina.
I don't see Cristina here yet, but Dr. Shoge has entered the room again. So if Lauren can unmute Dr. Shoge, she can finish her introduction.
Sorry about that. Technical difficulties. My power went out for a split second there, and I actually had to switch computers while my other computer is rebooting. So representing ASCO, as I think I mentioned before I cut out, I'm also faculty at the Pennsylvania College of Optometry, where I specialize in pediatrics and traumatic brain injury. And all of this to say is that I'm just very happy to be here to talk about these important results.
Thank you, Dr. Shoge. Is Cristina online yet?
Yeah, Dr. Artis. I think she just came in the room. So Lauren, if you can unmute Cristina, that would be great.
Cristina, we're introducing the audience to all of our distinguished panelists, and you're certainly one of them. So welcome, and would you tell the group a little bit about you?
Yes, hi everyone. I'm Chris Lopez. I'm with ESLOR, and I'm excited to join the group. I lead our talent, culture, inclusion, and diversity work here. I've been in the culture and inclusion space my whole career. I've gotten to see it across different industries and environments, and really excited to dive into the topic today and get a chance to share some perspectives and talk about where we go from here.
Excellent. Thank you, Cristina. So as you can see, this group, everybody's involved and deeply committed to diversity, equity, and inclusion. And so for the rest of the evening, we'll start off with Terrence giving you guys a high-level overview of the survey. This was an in-depth survey. Man, we've whittled it down to sort of the key issues that we think are of value to you, but it was very in-depth. And so, Terrence, if you will take us through the survey and from a high level. Thank you.
Excellent. Thank you, Dr. Ardis. I think the first thing to talk about is why we decided to do a survey after all these years, right? So I think about just hearing everyone's personal experiences, people of color, people of different genders, people of different sexual orientations. We heard all these expressions, but we wanted to really do an official temperature check of the industry to be able to assess how is diversity, inclusion, and equity going in different segments of the industry. And also to determine, is there certain groups that stand out that are having different experience in the industry that need to be addressed right away? And then finally, we realized that we have to attach action items. So once we have the numbers, which are very important to have qualitative data and quantitative data, the next step is to attach action items to different parts and to even see, are there segments of the industry that may have more urgency for some of these action items than others. So I'll go into what we decided to do is we first formed in our task force a survey committee. And as you can see, just looking at the survey committee, they're of all different genders, they are of all different ethnicities and races. We have those from the LGBTQ community, we have optometrists, opticians, we have trade publication, media editors, we have frame designers, we have reps, we have corporate optometry and industry represented. So we did all this so that when we're looking at the different questions and how to phrase it, we wanted to make sure that nothing was left out. But the first thing we decided is that even though we have this group of just amazing industry professionals, we were going to need someone to drive the ship. So we said, let's go with an outside agency that specializes in diversity, equity, inclusion. So we looked specifically for an agency that was owned by a minority, and we found Nonprofit HR, which is owned by a Black woman, and she has offices in about 3 different cities. And basically, she does these surveys for many different industries and many different nonprofit associations. So it was really good to have these specialists in there guiding us, forming the questions, knowing just how to word the questions to make sure they were getting the point across. Here's a little bit of breakdown of the survey. We had 2,610 people that started the survey there. The drop-off rate was 887, so about 35% drop-off, which we were told is pretty high for a DE&I survey for the industry. Mm-hmm. So it all came down to, we had 723 usable responses. 196 of them were outside of the US, mostly in Canada. So for total US numbers, we had 1,527 responses, which is a really great sample size. And you can see how it's represented, how the drop-off rate is represented in academia, suppliers and manufacturers, corporate eye care and retail, independent eye care and retail, as well as industry groups. And we defined industry groups as nonprofits, as buying groups and alliances, as those also involved in industry and trade media as well. And you can see here, this graph just gives a really nice picture of how the responses were coming in. The majority, the bulk came in from independent eye care, then academia, suppliers, corporate eye care, and then industry groups. But we got a really nice sample size from each of these segments.
Yep.
Here's the age and gender breakdown. So you can see it was 38% men, 61% women that filled out this survey. The age groups, you can see that we need a little bit more representation with some of the younger, more so the students. So a goal we have in the future, maybe next year, working with Dr. Hurd, Dr. Shoge, and ASCO, would be to redrop this survey and make it just specifically for the students to get some more concrete data as well. Looking at also veterans and military status, 5%, which is a little bit low when you have a sample size as large as ours, and 10% from the LGBTQIA community. I also want to say also we had 1% that was gender non-binary or non-conforming, which brings us to our first polling question. So Lauren, if you could go ahead and drop our first polling question. So I'll give you a few minutes to go ahead and answer that. It's regarding gender non-binary, what it identifies as and what it refers to. Give it just 5 more seconds. All right, thanks, Lauren, appreciate it. Excellent. So go ahead and close the survey out. So Lauren, so basically gender non-binary are those whose genders do not identify with the common norms or the common male-female binaries. So those who identify as gender non-binary, they may, but not always, may identify with more androgynous genders. They may, but not always, prefer pronouns such as them or they versus him or her or he or she. So if someone does identify as gender non-binary, you may want to ask them what pronouns do they prefer at the workplace or your organization. Here's the race and ethnic breakdown of the survey. As you can see there, the majority were white, the second were Black, Afro-American, Asian, Hispanic, Latino, Latinx. Quite a few identified having 2 or more races, and then it goes on from there. What we decided to do on this survey is to break it down by 5 key areas. And here they are here: commitment, belonging, inclusive culture, equity in systems, it rewards, recognition, and advancement. And for the purpose of our discussion today, we're going to actually have this discussion lead and follow the same exact format. We'll take one of these key areas and we'll explore just 1 or 2 stats that jumped out from each segment of the industry. And just so we're following along correctly, sometimes we may see a number like, oh, well that might be good, or that might be bad. We're not doing so bad or not doing so good in this. This gives us a key. Anything above 85%, that means that's a pretty good strength. So we could say anything above 85%, this part of the industry is doing well in this area. 84 and 76%, it could be a mixture of an emerging strength or an area we want to keep an eye on for possible weakness. And anything below 75% is something we definitely want to identify as a weakness, and we definitely want to be cognizant of how we want to handle that as well. So to go into the survey, I'm going to turn our attention back over to our moderator, Dr. Ardis, and he'll go into our discussion for our first segment, DE&I commitment.
Thanks, Terrence. As Terrence mentioned, there are 5 categories that we looked at, and just to level set everybody, when we look at DEI commitment, essentially, is your company, your organization, your practice, committed to advancing diversity, equity, and inclusion in concrete ways, right? And so a series of questions were asked about that, and they were asked to everybody, from the doctors to the suppliers to the executives to staff, et cetera. And so what you're going to see today are the results from each of the subgroups regarding their organization's commitment, right? And so, Terrence, slide it up, if you would. Move to the next slide. So in the area of commitment, 86% of all the individuals responding indicated that they believe it's important to focus on this, right? So that's significant. And then when we looked at the various subgroups, the academics, the suppliers, the CEOs, you can see these are some of the highlights. And our panel has seen these highlights, and they all had some comments about some of these. I think when I first saw this, the thing that struck me is that 59% of the respondents indicated that their organization has conducted or plans to conduct training on the topics of diversity, equity, and inclusion. That seems really low to me. Coming from industry, every organization that I worked in, we made this a priority. And so to me, that was real enlightening and says that we've got some work to do in terms of industry, training people on topics of DE&I. From an academic perspective, any of our academia folks have comments about the respondents in academics in schools?
Yes. Okay. One thing that I thought was kind of interesting, 73% wasn't a bad number, but I thought it would be higher because I've been at 2 schools throughout my career, and DE&I issues were always big parts of things that we talked about as far as admissions, as far as student affairs, and a lot of the things we did in those settings focused on exposing individuals to the profession and making sure that we could kind of meet individuals where they are so that they can be successful.
Interestingly, Dr. Ardis, I just want to add, so these last few years have been challenging. 2020 was not only the pandemic of COVID-19, but again, it highlighted the longstanding pandemic of racial issues. And so our NOSA students, so just to let everyone know, the National Optometric Association has a National Optometric Student Association. So the 73%, I'm a little surprised. I thought it's a good number, but when we met with our students, our NOSA students, there were concerns. So I think when we think about the school's commitment, maybe it didn't translate to our students well. And I think that's the opportunity for each and every colleges of optometry to make sure that our students understand what our policies are, who their DEI officer, what are steps and measures that the schools have that support diversity, inclusion, and equity. So the school may be doing a great job, but I think the students need to sort of understand that and to feel that. And I think that when we looked at our NOSA students, that wasn't maybe not well communicated. There are times when I say this all the time, diversity is not just one person of a minority in a group. That person doesn't feel always included. So I agree that the admissions officer and the admissions program, they're doing a good job, but I think that more needs to be done. So although the number is 73%, I would think that's something that we need to improve upon as we go forward. And also to the 59% when it comes to CEOs and leaders, when I think about that, that's corporate, but I would think also in the upper echelon of the colleges and schools and colleges of optometry, the leadership component as well. When you say DEI training, I have to say I've been in academia a long time, and we may have some sporadic DE&I training, but not across the board. So that's something that I see that we're improving upon, and I'm glad to see that we're working towards that collaboratively as organizations that we can continue to improve upon going forward.
I couldn't agree more with that comment, and in particular around the, I think it's been top of mind, but whether the entire workforce or that people are actually feeling like anything is different, or that they're seeing it or experiencing. I think that's where the rubber kind of meets the road. And when I think about kind of what we say and the alignment with what we're doing, the say-do gap that you usually have, I think there's been a good deal, especially over the last year, of progress in the kind of in the knowing, like the head part, like I know that this is important and it's something we need to deal with. I think there's even made some progress made on aligning that with the heart, like I not just know it, but I believe that something needs to happen. But we haven't quite translated into the do part and figure out what exactly are we going to do that makes an impact. And I think there's a shift happening right now that clearly there's more room we need to grow in and move into, but it's to understand when it comes to just measuring our progress, are we just measuring activity? So we said things, we threw some programs out there, or are we measuring impact? And are people actually feeling like this is different? And it's that number is a wake-up call, because clearly it's not feeling like we're making the progress we need to, and we need to start getting to that doing and making that impact part of it.
Absolutely.
I very much agree with what you just said, Cristina. And us being, you know, when this survey came out, just really being in the thick of the racial tensions that have been occurring in this country, and how the schools have been responding, I wonder if, because the conversations have, you know, was born out of all of this activity, if this is slightly higher or lower than what we would have maybe gotten had the survey been conducted last year. So I hope that, you know, in the next 12, 18 months or so, we have the opportunity to perhaps revisit the survey again.
Absolutely, we will.
And reassess, you know, have we put plans into action, and have we actually seen things through? Because there's one thing to talk, and there's a whole other entire thing to do. So I agree with that.
Dr. Shoge, this was our baseline survey, so absolutely we'll revisit in the future. The other thing thing that stood out to me in this commitment area was when you look at independent optometry versus corporate optometry, in terms of feeling that their board or their management team demonstrated commitment to this. Corporate optometry was a lot lower, and you know, we felt that there were a couple of reasons. One, you know, in an independent optometry practice, for the most part, and many of the practices are in small towns or communities that are homogeneous, so they don't necessarily have a lot of diversity within these practices. But in corporate practices, they typically are in metropolitan areas where they have a diverse workforce, they have a diverse sort of patient base, and 61% was awfully low. And certainly, I can't wait to visit with some of my friends who work in corporate optometry. I think there's a lot of work to be done there.
Dr. Ardis, I also want to add, as far as independent optometry, it's interesting because I'm in the city, so I kind of feel like I'm in a melting pot. And I've noticed in corporate, maybe it's a little bit more serious, or they're trying to be more professional. And in independent, which is where I am, it's a little bit maybe more laid back. It's easier to make changes. But what I do believe is so important here is that in the survey, we see that people do believe that it's important. 86% of individuals believe that it is important to focus on DE&I. And then when we look at these numbers, the lower numbers especially, it really gives it's eye-opening to know where is it that we need to improve first, right? So I think it's great that we did this survey, because it gives us a foundation of where we are, so that we know where we can move forward in the future.
Thank you, Dr. Canto-Sims. I agree. Any other comments or questions on in the area of commitment before we move on to the second area that we focused on? Good. Terrence, let's move up to belonging. Belonging was the second area. And it's belonging is what it says. Do you feel like you belong in the workforce at your organization? And if you'll go to the next slide, Terrence, it was interesting. When we asked the various groups, a couple of things stood out. Again, corporate optometry really performed at a low level, that the doctors and the staff and corporate optometry offices or opticals felt that they couldn't bring their authentic self to the job. I thought what was really interesting is under corporate optometry, where it says 64% of the respondents said they feel comfortable bringing their whole self to the workplace. Look at the breakdown between the white employees and the people of color, the 55% people of color. I thought that was pretty significant. And even the men versus women, the men felt they could be their authentic self and the women not so much. And again, 58% of the employees in the corporate opto space felt that they had the ability to voice their concerns. So we would hope that more than 58% of the employees felt that they could voice their concerns about DEI. So that stood out to me.
And I agree, because in being an independent optometry, I've interviewed candidates that come from corporate, and they have told me that the moment they walked into the practice, that they felt like it was, family-owned practice, that they were able to feel a lot more comfortable being able to express how they feel. And again, I agree with you, the fact that maybe independent being a smaller group allows people to feel more comfortable bringing their authentic self. So there's definitely work to be done in corporate, so that we can bring some of the feelings of independent into corporate, because those numbers are extremely low.
Absolutely.
Dr. Ardis, what really stuck out to me and really spoke to me is, the first question about being comfortable of bringing your authentic self to work. Anyone who knows me knows I love expressing my authentic self through what I wear. And you go to sometimes in organizations, they may have very strict dress codes. Mm-hmm. And sometimes those strict dress codes, they really can, limit.
Yeah. Oh, absolutely. Absolutely. I think really.
Dr. Ardis, I think we lost Karen, but I want to add too, when I think about authentic self, I think about me, all of me. I'm a Black female, and one of the things when you highlight women versus men, women still feel, and there's still some issues with men and women and a level playing field when it comes to that. And sometimes, if things happen, we don't always articulate we're not comfortable with the situation. Our authentic self would be articulating that we're not comfortable with the situation or this happens. I mean, even for our students in academia, I will tell you that they may feel a certain way, but don't feel that they have the voice. And this is why these presentations are important, because our students need to feel that they belong to their institution. And even for organization, I know that we didn't have the stats on organization, but I want to make sure that I feel that I'm included or feel part of an organization, that I belong, and therefore I'll be committed to that organization, right? So I think organization, when we look at that, it really, the organizations are doing a better job, but it really needs to reflect the patient population that we serve. We serve a very diverse patient population. And if an organization embraces that, then I bring my authentic self to the table a bit. So I know there's a lot of work to do, but I just think when we talk about authentic self, it's not just the dress, which is great. I have these awesome frames on, but being able to speak up, being able to speak out when things are not right, that things are not being said, or we don't feel that we belong or we're included. So,
and not
I was surprised.
I'm sorry, but they've done studies that show that then when there is diversity within a company, that company thrives, because if everyone is the same and everyone thinks the same and everybody shops at the same place and likes the same things, and there is no diversity, there are studies that show diversity is pivotal for a company to thrive. So this is why this is so important.
Absolutely.
I would add to that. I think that when you think about the diversity component and where this belonging piece is so critical, you can certainly have diversity, and we talk about having diversity around the proverbial or virtual table. But if there's not inclusion, if there's not belonging and ability to share your voice, all that diversity is not actually getting actualized or brought to bear on the business and our environment and our communities And so that mix of all those things together is so critical. And when I think about this belonging piece, I think about the ability for me as an individual to feel like I belong there, but also my ability to influence the environment, right? I'm part of the fabric and the makeup of this group. And so I also help shape belonging for others. And that ecosystem of when we belong, then we can share, we can say, hey, we're off track. Our environment isn't delivering on what we committed to. That's when you truly can share your voice, when you really are a part of it. You're not only a part of the belonging, but you're shaping the belonging. And I think that's exactly it. And from the business standpoint, I love your point. I like to say that we pay a price for not having diversity around the table. And you either pay it because you're missing out on things, or you're going to have to buy it in consultancy or other groups that can give you that perspective. Or, I mean, we've seen plenty of companies to have a black eye to their reputation because they went out there with something that didn't understand their environment. So there is a price, there's benefit, but and there's also a very real price to pay for not having those diverse voices actualized and being able to express themselves in that room. But yeah, I couldn't agree more with that aspect of it. The studies are there and all of that, right? And now it's up to, are we going to actually go in and live it? Are we actually going to do something about it?
Yeah, I also think the other thing that diversity brings to the table that we may not think about it as much is resilience. That's really important. It helps everybody to be able to pick themselves up and keep moving forward. And that's extremely important when you're dealing with things that, you know, there may be differences among people, but people can pick themselves up, brush themselves off, and keep on moving.
Dr. Hurd, Shoge, and Sherrol, Dr. Reynolds, at the schools, does that 77% of the students feeling comfortable bringing their whole self to the institution surprise you?
It does not surprise me.
It's not surprising. When we look at the numbers and we think of 70 some odd percent, we're like, okay, that's average, right? We're in a C+ range. And I don't think that's where we want to be. And especially as, you know, what some of the other panelists have said, a lot of schools are pushing for this and making it a numbers game. And I'm part of a university that's, you know, on the more diverse end. Yeah, we've heard from our students that it's not, you know, it's not just a diversity. Do I feel heard? And for me, that belonging piece is that, do I feel heard when I voice a concern or when I voice an original idea? You know, how long does it take? How much effort do I have to put in to be heard? And that, you know, that's part of the belonging piece as well. And I think we've got a lot of work that we need to do to improve those numbers for both students and faculty. And the fact that, you know, our student population are majority female, and females are still feeling that they're not able to bring their whole selves. That's concerning. You know, why is that? So I would really love to dig into the why and address the hows of this. And I'm certainly not surprised to see the discrepancy between white and persons of color in terms of them feeling like they belong in an academic setting.
Well, I do want to give you a personal plug, because Dr. Shoge is at the Pennsylvania College of Optometry, Salus University, and they've been real aggressive in this area. In fact, we have a member of the board of trustees at Salus that is a gay man, and he's taught us as board members so much, because we just could not, we just didn't think like he thinks, right? And I think that putting folks who are, you know, non-traditional, non-white male in those positions of power helps the organization. It certainly has helped Salus. That young gentleman has done a great job with our board of trustees, bringing the way that he thinks to our decision making. So I applaud what you've done there, and Salus has done, Ruth.
We have to remember the root word of diverse is just different. You know, yep. I know we try to use a lot of fancy words when we're talking about this, but it just means different people, different ideas, different ways of, you know, thinking and responding. And that those differences are our strength and not a weakness. You know, I think sometimes people want to think that if there are too many different types of voices, too many different types of people, you get pulled into different directions and can't coalesce around, you know, what your mission or values are at an institution. But I really think it's the opposite. You do better. There's just this energy, you know, when you have these differences and you're in a different space. It's a different vibe, as people would say these days. It's a vibe, man.
Any questions from the audience? Any other comments on the topic of belonging?
No questions, Dr. Ardis, but I provide the audience, feel free to please chat me over your questions if you have any.
Terrence, we'll go on to the next topic, was inclusive culture. As it states, it's one that really accepts and values these views that we've been talking about. Absolutely. Time for a polling question. Terrence, I wasn't familiar with this term microaggression until we started the survey myself. So this is a good one.
Definitely. You know, we see it used more and more, especially in this climate. And so far, everyone's doing a really nice job of answering it. We want to keep it open for the 10 seconds. So if you want to go ahead and register your answer. All right, Lauren, if you could go ahead and publish the results. Excellent. Thank you.
Okay, good. Everybody, I guess it's pretty intuitive. So, yeah, these were, again, if anyone's interested in the entire survey, please reach out to us. We can provide that to you, because it was a lot more in depth than this in this area of inclusive culture. However, these were 3 that really stood out. And that a quarter of the respondents indicated they've experienced microaggressions. That was surprising to me.
You know, Dr. Ardis, what's really interesting when you look at 24% of all respondents, if you break it down and you see, especially, I mean, understanding microaggression, I mean, most people did well with the definition, but it's subtle, it's unintentional. And, you know, a lot of times we apologize, or did that person really mean to do that? Or sometimes we overlook that. That number is pretty low. We think that number should be a little bit higher, because there's maybe not a full understanding of it. But when you look at people of color or a person of color, it's a little bit higher there, because we understand, or a minority person would understand what microaggression is. And again, would we talk up? Would we speak out? Would we make it known to that person that they have subtly did that? And we could talk about how we can move forward from that. So that number is pretty interesting, I have to say.
And it comes down again to the belonging, right? So if I experience microaggression, do I feel comfortable enough to say something about it? Or do I have a coworker that sees that and steps up and says, you know what, that's not right, you know, because maybe the person doesn't know that they're doing it. And so sometimes we need, you know, in our industry, educate people on what a microaggression is. And when it does occur, be comfortable enough to speak up and say it, or step up for a coworker and say, you know what, that's not cool. So that's really important. I think that's why this survey is so great, because a lot of people don't even know it's going on, but it is.
Yeah.
That is a great point, Dr. Canto-Sims. The fact that, you know, if you don't feel like you belong, you may not be comfortable expressing the fact that you've been, you know, you've received a microaggression. So I think that's a great point.
Well, I think one of the things that's exciting about being able to talk about some of these things is sometimes the death by 1,000 cuts is tougher to deal with and has longer implications than the one overt thing. If someone does something overtly racist, misogynistic, just hateful language, it's easier for us to be like, whoa, like that is wrong. And people will speak up. It's a lot tougher when it's someone you like or have a relationship with or says something. We start talking ourselves out of it immediately, right? They can't have meant that. They might not have realized what they said, and we don't call it out, and it starts compounding. And there's microaggressions and also micro advantages, right? I'm always going to have this person present because I think they're just polished or corporate or whatever it is, and put them in front of the room where we're not giving that advantage to others. And it may be small in meetings, but as that adds up, you're giving opportunities to someone slightly each time, and that adds up. And the microaggressions are tough to speak out about. I think where we need to go, which I think it's an easier said, hard done, but where we need to go is where we can talk about a microaggression the same way we would talk about someone having something in their teeth. I would want you to tell me you have spinach in your teeth, and I wouldn't think they're attacking my health or my hygiene habits or anything to that effect. But when we call out microaggressions, when we say, do you realize that you usually only ask the woman to take notes in the meeting, or you're constantly calling me this nickname where you call everyone else by their full name or their title, or you don't pronounce my name correctly ever. You immediately go to are you saying I'm racist? Are you saying I'm not inclusive? And it's so heightened, but we need to take it back to we're just talking about that one thing that we need to fix and address. And can we talk about it the same way as that spinach, rather than it becoming this huge issue? And if we look at the micro part of it, and we understand that even the micro stuff we need to start dealing with, we can be receptive to it, understanding that it's a micro thing that we can address, and we can get more comfortable calling it out. But right now, it's just, everything is so big that it actually paralyzes us from addressing the things that could be easier to address.
I love that you use the term micro advantage, and it's not a term I've heard or used before, but I love it, because maybe, I think when we talk about, we're talking about microaggression now, but as you say, we kind of go outward really quickly and think more about oppression and that discrimination. When we talk about oppression, you also have to talk about privilege. That's the balance of the scale. And so when you're talking about microaggressions, you do have to talk about microadvantages, which is why I love that term. And I think in the same fashion, we want to encourage people to talk about microaggressions. I think we also have to point out those microadvantages, to ourselves. Like, why do I continue to give certain people honors, but other certain people not honors? Or why do I, even just how you feel or talk around certain folks compared to other people, what's going on in your mind, and being able to have a conversation about it. And I think, being able to talk, being able to be honest, but also being able to feel like you're not going to be in a threatening situation is important for both sides. And I think, honestly, both sides of the coin with your microaggress or microadvantage are very sensitive right now. And I can understand and appreciate that and embrace that. But, having a conversation and being able to point out both of those things when they happen, I think is really what's going to help shed a light on things.
Yeah. Absolutely.
And also too, having that conversation leads to an inclusive culture, right? So again, we talk about inclusive, we talk about microaggression, on the one with the optical industry, just even with conferences, Dr. Ardis, I said this before, sometimes I don't feel that I'm included. And I say these as personal things, just as my personal experience. I may not feel as included when I go to conferences if it's just me by myself, and there's really no diversity. So again, an inclusive culture is, regardless of the culture, you feel included. So it doesn't mean, I just want to make sure that everyone understands that, that feeling inclusive allows us to speak up and speak out, but it also allows us, each one, to teach one, right? So when we talk about microaggression, we can teach each other those areas that are concerning that we can improve upon. So I see the other numbers, and that's also concerning when you look at feeling inclusive or being inclusive when it comes to conferences or represented in marketing. So I've sat on some National Eye Health Education Program, and imagery matters, right? When it comes to patients and things of that nature. So even with marketing, there's issues of inclusiveness there. When you look at diabetes, a disease that affects everybody, and diabetic eye disease, we need to make sure that people who have this disease are represented in the marketing so that they feel that they're seen as well. So it's interesting with the other numbers that you have there.
Yeah.
And if I could jump into the marketing, because I've been in the industry for over 20 years, and how I wish that the marketing would step it up. I've been in private practice for over 16 years, and the reality is our patients do not see a reflection of themselves in the marketing that we have in the optical industry. 60% feel that they are not represented. 47% don't feel represented of people of color. I think that number is actually lower, because in my practice, I've been doing my own point of purchase material, all the imagery in my practice. I have to schedule a photo shoot just to be able to have the imagery and the people see and reflect themselves in all of the point of purchase material. So the industry needs to step it up, not just in the imagery, right? But also all of the resources that they provide us as eye care professionals. If you're selling a product, if you're selling frames, if you're selling a service or equipment, do you provide information, brochures, digital resources in other languages? Because we have patients that speak other languages, and maybe we don't speak that language, but we're able to provide our patients with the information that they need, either in a hard copy or send them to a website where they can read and know more about the product that they need. Because we're here trying to see patients. We're trying to help them see better with dry eye, myopia control. And now we have to stop what we're doing to translate. We have to stop what we're doing to create imagery for our patients. It's important that the marketing really steps it up when it comes to diversity in the marketing and inclusive. So I just have to say it, because things need to change. Like the marketing needs to change. We really, there's very few companies that have stepped it up to really have diversity and inclusion in their marketing.
Yeah, and that one, and that one's bad for business, Dr. Canto-Sims, right? Like that's just bad.
You're trying to sell,
right?
But only to one demographic.
Absolutely.
Dr. Artis, I have an experience. I know that we have very few Black-owned frame vendors in our industry. One particular who shared their story was Coco and Breezy, who've had some of their customers call and say, "Hey, would you mind sending me more POPs with less people of color and more white people in them?" They said, "Well, why do you want that?" "Well, because I don't have many white patients. I don't have many white customers, and your POPs don't speak to them." And their response was, "Well, you probably don't have many patients of color because you're not marketing right now, people of color. So maybe if you did and put up our POPs, you will start seeing you'll get more customers and patients of color in there as well." I came into Mito a few years ago, which is in Milan, and a company, Italia Independent, and the CEO was showing me. I walked to his booth, I saw it right away. He had his POPs of not just people of color, but interracial couples with people from the LGBTQIA community. Another one I think does a great job, Dr. Canto-Sims, you mentioned LAI Works, who looks for people of color, looks for people from the transgender community in their marketing as well. Yeah. And he would be more inclusive. When you go past their window on Melrose, you're like, this is an optical shop that is for everybody. You want to be in there.
And I'll say more, if we talk about the optical industry conferences, I'll share when I first started. So in my practice, I see mostly Latino, Afro-Latino, Indigenous. I had so much trouble finding frames that would fit my patients. And I remember going to conferences and asking frame companies, do you have a frame that's maybe wider, not as deep? And I had frame designers in their booth tell me, no, I would never design that. Nobody would wear that. And I'm like, no, I have an optical that I see filled with patients that would buy this design because this is what they need. And they basically said, I would never design that. No one would buy that. And that's actually how we started designing eyewear for our patients, because I knew that nobody else in the market was catering to the Latino community, the indigenous community. So someone has to start. So that just a tip right there, like, we're here, we want to buy your products, but you have to start designing them and marketing them to us.
Yeah. Well, it seems like recently we have an emerging cluster of people of color who are starting their own frame lines, right? And so it's really it's a chain of reaction. So they can have a product, but how do they get them into people's hands and offices and acknowledgement? And so making sure they are able to have booths at these trade shows so people can interact with them, and making sure that they're in touch with people who could help them with marketing, especially if they're just starting out. And so having those resources that might be very obvious and commonplace for some people, if you're trying to start, a revolution and provide services that weren't in existence before, making sure that there are strategies in place to help folks along. So that we're not still saying, well, there's nobody here to provide, and there's just a disconnect between what they're trying to do and what we're trying to do on the other side as optometrists. I mean, simply walking into the optical, like a couple of days ago at my school, I asked, do we carry any Black-owned frame lines? And I think they said one. Our patient population is a good 85 to 90% Black. Why do we only have one Black-owned frame line? So things like that. I think, if we really start to challenge the system and ask the right questions to the right people who could actually do something about it, then we can help to facilitate that very necessary change.
Absolutely.
I do want to touch on that second one, since I do plan industry events. I think it's really important that it's not just that perception is attended by diverse backgrounds. About 1,000 attendees at Vision Expo are international, mostly from South American countries, European, African, and Middle Eastern. But who are we putting on a platform at these industry events? Who are our speakers? Who's taking part in our panels? When you go past a main stage, do you see people of color, people from the LGBTQIA community? Do you see a balance of men and women on panels? Or we are an industry that caters to a large amount of percent of the people that have a disability, eyesight. Absolutely. What are we doing within our industry events to be able to feature those? Maybe even keynote speakers. Are we looking at people there that have disabilities or diverse abilities? I think it's really important, not just attendees, but who's being put up saying, here is the industry standard right now.
Absolutely. And Terrence, I do have to put a plug in for your organization again, the Vision Council and Ashley and the leadership. Even when we started this survey, early on, we went to the CE planners for Vision Expo, and Ashley pretty much demanded that we bring more minority CE speakers to the podium and to expand our CE speakers. So, that's one of the actions we've already taken. And I think it was big, because you've got to have that presence throughout the conference to make people feel like they belong in the conference, right? And so kudos to the Vision Council for already taking the lead in that area.
Thank you. We have a ways to go. Thanks to our task force for helping us develop this. We look forward to start right now for Vision Expo East, and we hope that 2022, we will see at least 20% of our speakers to be speakers of color.
We've got some talented
Dr.
speakers.
Ardis, I wanted to add, this is why the NOA started. So I can't not let this conversation go without saying that exact reason, giving people the opportunity, diverse background, opportunity to speak and lecture, is exactly part of why the NOA started. We come 50 years or more now, and we still see that we have some issues and some problems, because it's not just getting on the stage, right? It's having the opportunity to learn how to speak in front, or to get that experience to speak in front of individuals. And so the NOA has been on the forefront of that. That's one of my first conferences that I've had, and Academy, I've been been awesome. I think, like I said, Dr. Hurd, the diversity task force, and also the membership pillar chair for Academy, is taking a lot of great steps forward to make sure that representation on the stage matters. When we see ourselves on the stage, we feel included in those organizations. We feel part of the organization, and we want to come to those meetings. You know, a lot of times I may not go to a meeting because I feel like there's no representation of me there. So we've made a great stride, and we just need to continue to do that. I don't want to do it for now. This is not a sprint addressing diversity, inclusion, and equity. It is a marathon. And as I said, the NOA has been at the forefront of this for well over 50 years. And you can see that in 2020 and 2021, we're still addressing these issues. So that is a big part. So I just wanted to bring up that we have been doing that for a long time, and we will continue to do that so that we can produce a lot of great speakers for conferences.
Absolutely, and NOA has produced some of the most talented speakers in our industry and given the first opportunity to present. So thank you for reminding us of that. Yes. Terrence, let's move to the next area, the area of equity and systems. This one's probably the one that I was most passionate about because as a supplier or working in the industry, you know, senior leadership, I've been in meetings for the last 15 years of my career with every major company in our industry. And 95% of the time, I'm the only person of color in that room when we're in senior leadership meetings. And so this one is personal for me. And we've got a long ways to go as an industry. And I think that for us to actually address these issues of belonging, the issues of commitment, the issues of inclusive cultures, we have to start at the top in senior leadership positions in these schools and organizations, right? And so I think this is probably the most important thing we can do is if we can give more people of color opportunities in senior leadership positions. And as you can see from the stats here, we've got some work to do.
I think it's important, Dr. Ardis, if we can define equity. There's always, you know, and Dr. Shoge is here, so there's always, is it equality and what's equity? So, you know, when I describe equality, we're all equal, we're all given the same access. For me, equity is everyone's given the same opportunity to advance, right? For the, you know, you're invited to the table, you have the seat at the table, you each are given the same opportunity to move up. So I would love to hear Dr. Shoge sort of kind of give us the definition so everyone is clear on what equity really means.
I think you just defined it very well there, Dr. Reynolds. Thank you for that. You know, I like what you just said, that given the opportunity for advancement, because when, you know, we were first hearing about or reading the statistics here that, you know, roughly half of nearly every part of industry except for independent optometry feels that there is an imbalance in their leadership representation. One thing I would add to that, aside from understanding equity versus, you know, which is how you distribute resources, essentially, you know, are you distributing in a fair manner? One thing I would say when we're looking to achieve equity in our leadership positions is, this is what's not needed is to don't just throw people into these situations, because I'm starting to see a little bit of that as well. It's just like, okay, you're a minority. Let's elevate you. You know, make sure that people have the training and are ready to take on these leadership positions. Because the last thing we want anyone to do is fail at whatever it is that they're trying to do. So when we're talking about equity in the system, it's giving, you know, the same kind of access to advancement, and that fundamentally includes the opportunity for training to get to these levels. So I also, you know, I want us to be sensitive and aware about some of that culture that we're starting to see now as well.
That's a great point, Dr. Shoge. Yeah, certainly you have to have the opportunity, but you need the support systems and the mentoring to be successful. You need to be placed into situations where you can succeed. When we had most of the questions regarding equity and systems that were asked, and like I mentioned earlier, guys, there are a lot of questions. They really focused on, do we have people of color in decision-making positions, right? In leadership positions? And do we have people of color who have opportunities to advance into leadership positions? And so that's what most of the questions focused on. And as you can see with the academia and suppliers, only half of the people felt like their board or management team, whether it was the school, senior people or the industry senior executives, were reflective of the diversity of the workforce, right? And so, or the organization. And that's appalling to me. Mm-hmm. And I really think that's the area that I get real passionate about. We need to, you're right, Dr. Shoge, it takes some time to develop people, but you have to give an opportunity first and then put some systems in place for them to succeed.
It really comes down to, again, academia, suppliers, corporate and independent. If there are people at the top that are diverse, that is only going to help your organization, because when you have diversity in leadership, you will come up with some really good breakthroughs, because you have the diversity in the way they think and the way they live, their lifestyle, all of that. And that is only going to help academia, and that's only going to help companies, either private or corporate, and the suppliers. So if we change and shift our mindset and understand that having diversity in leadership is only going to help your organization grow and think outside the box and really, really kind of pivot how you're doing business, because the reality is this needs to change. Like, these numbers are really sad. We really need to start doing something about it. And I think one of the first steps is looking at leadership and making sure that every single company looks at diversity in their leadership.
An interesting model that I heard recently in a committee I was in is that, this kind of leadership development program they're establishing, they have key people helping to deliver that information. And the idea is that you're not going to rest in this position that you have. This is maybe a 3-year term. Mm-hmm. And so the thing that I want people to start thinking about, when we're talking about leadership, because a lot of times, again, this stuff that we're talking about can be very abstract. And so a concrete way of thinking about it is, who are you training to replace you? Mm-hmm. Or who are you bringing along with you on your journey as you're moving ahead? And does that person look like you, or do they look different from you? And so I think when we try to make this more tangible, like, okay, how do I actually do this work? When you get into certain positions of leadership, don't think about them as permanent tenures. Like, okay, I'm going to do this for the next 20 years. That's exactly the opposite of what we're talking about here tonight. Who are you bringing along? Who are you training? Who are you mentoring? That's a big word that you need to use more to ready them for these positions. So there's always this pipeline. And I feel like we need to get out of the rut of being caught by surprise by these things, because these are new conversations that we're having, right? At all, whether for this industry or what we're talking about as a country in general. These are new, and we really need to stop being surprised by them. So we have to think about, how do we do business differently? And so part of doing business is, and something I'll challenge people in, is look at who's coming behind you, look who you're pulling along with you. Yep. And do they all look like you? Mm-hmm. That's one of the first things we can. Who's part of your circle, and how could we start to change the look of your circle?
I think that's
great point.
I tell you, it really is. And I think one of the ways when we think about these stats, right, and how do we start moving the needle, because these are big things and things that don't change overnight. It's what are the things that actually drive representation? What is the thing that actually drives what that C-suite looks like, what those top levels look like? And it's a mix of processes, right? It's recruiting, it's retention, it's advancement. It's really understanding what the stats look like and what the disparities are there, because that's actionable. The end representation one is hard. You can't nudge it overall, but you can start saying, you know, if I see that I'm losing women at a higher clip than I'm losing men when it comes to voluntary attrition, then I need to address my attrition issues. If I'm not seeing that, you know, we've got diverse representation that's reflective of my workforce in our development programs, then I need to address the way that we're selecting for development programs. But all of those different things need to start that ecosystem of what drives that end number of representation. We need to start really looking at each of those. To your point around looking at, is it equitable, right? Are those support systems that help people get into those ultimate roles so we can have, you know, that the ultimate representation we want? Are we shoring up the gaps that are causing that inequity in our systems? And that ecosystem part, which this is why I love this segment of the overall survey, because it addresses, I think, the infrastructure and the part that will make this sustainable, not just a one-time program or a one-time initiative, but that we fix the systems that are actually causing this ultimate representation gap. How do we start fixing it? And then how do we make it self-sustaining? So I get to work myself out of a job. You don't need a diversity, equity, and inclusion person at companies to help drive some of that, but that it's just embedded in the way we do business, addressing those gaps.
Great.
You know, Derrick, Ruth said something on a panel when we were addressing this. I don't know if she remembers that. All we have to do is change the rules. The rules can be changed so that we can allow for more equity. So it doesn't have to always be the same. This is how we've always done it. The rules can be changed to allow for more diversity and more equity. So I love that saying.
I'm going to quote that one, Dr. Shoge. I really like that. I really like that. And I think you're right. I mean, we have these systems in place. We have these rules. We have these qualifications in place. And diversity is a good reason to go ahead and break those systems. We have to, in order for it to survive, we have to. You know, we think about selection of speakers, selection of different, you know, board members. You know, we have different criteria, but we have to break those criteria in order to make room for D&I. So I'm definitely quoting that, and I'm putting on my next presentation. Thank you, Dr. Shoge.
Yeah, and I'll close out this section with one final comment. The Vision Council hasn't committed to this, so please don't quote me. But one of the things that I'm going to urge of the Vision Council is that every Vision Expo meeting, we have a reception for executives or folks, people of color who want to move, want a job at Essilor, want a job at J&J, want a job in industry. And we bring the C-suite executives, the HR people, and bring their resumes and develop relationships. Because when it comes to advancement in most of these organizations, at the end of the day, it's really all about establishing those relationships. And as you mentioned, Dr. Shoge, you know, I'm going to go out and find a relationship with people that look like me. It's easier to have that relationship than to have a relationship with someone that doesn't look like me. And so what I want to drive the Vision Council to do, and the AOA and the Academy and everybody to do, is have a reception at their big meetings, bring in talented candidates of color, meet them, introduce them to your C-suite folks, let them develop relationships, because that's how you advance in corporate America. And so that one's a big passion of mine. I hope the council takes that as a recommendation moving forward. Terrence, let's move on to rewards, recognition, and advancement. This one's very interesting. And I tell you, the academia, the first bullet for academia just caught me. When you compared, you know, the white to the people of color in terms of advancement in their career, I thought that was surprising. But I guess for you professors, not so much.
Not so much.
Yeah,
Okay. Okay.
I think this is similar to the previous slide in talking about equity and systems. If you're not part of the system, if you're working within an inequitable situation, there's no way you're going to get rewarded or recognized unless there's it's almost unnatural, which is disappointing to have to say that if you end up being a person that does get recognized, it's like, whoa, this person did all of these things. I'm like, whoa, I've been doing these things. You're just realizing that and recognizing that. So, you know, it's not surprising, but again, we can't get to the reward until we deal with the equity and the system that we have in place.
Once again, with this particular category, rewards and recognition, corporate optometry has some work to do. So we're certainly going to share our results with our friends in corporate optometry. You can see they certainly lag behind the rest of the industry.
Do we have people from corporate optometry on the call now?
We do. We have. I saw quite a few in some of our members of our retail division are in.
Interesting. Yeah. Yeah.
I guess I wonder what their reaction is or if they have a response. I mean, with this kind of information, it takes some time to digest. So we have the advantage of having seen this information prior to tonight and talking about it amongst ourselves. But I'm interested in kind of hearing reactions from folks in the audience as you're getting this information newly.
The one thing that I know we're going to talk about next steps a little later, Shoge, but one thing we discussed at our last task force meeting after, again, we've had the ability, our task force, to look at the survey since November, the results, and analyze them. We really decided that we need to split up into two teams in our task force, one for our suppliers and manufacturers and one for corporate optometry, and have those two teams focus on what can we do to educate these two segments, but also to move the needle forward, whether it comes to training programs, where it comes to recruitment programs, to suggested criteria for hiring, training, and development. But we just did that 2 weeks ago, I believe, Dr. Ardis it was.
Yep.
We have a really great motivated team that are looking for ways that they can assist corporate optometry and suppliers right now. So I look forward to, Dr. Ardis and I were volunteered to be on both committees. So we look forward to seeing what comes out of that and what members, the Vision Council members are in corporate optometry also have to say.
Yeah. It's interesting when you compare that to the corporate optometry responses again to independent. And I do feel that the independent space, it's probably part of it is because of the homogeneity of the practices. Typically, they're in these sort of suburban American markets, and everybody kind of looks the same. And I know you're, Diana, in a unique situation, but when you look at all of the independent practices around the country, you know, typically the minority doctors practice in the minority community. The majority practice in the majority communities. And so the issues of diversity aren't as apparent, but they're there. But in corporate optometry, it's just like working in a corporate America environment, and you're in a major metropolitan area. And this is sad, particularly the prior slide that even talked about pay, Terrence. The corporate optometry folks felt that their pay, minorities' pay was low compared to the majority. So
that's actually pretty. Except for independent optometry, compensation was something we saw that was a problem for all segments of the industry when you compare different demographics. We compare men to women, people of color to white people.
It was consistent.
It was really consistent. It actually had the biggest, honestly, the biggest margin there that we saw. When you compare demographics, I think we really have some work to do analyzing compensation, analyzing equal pay when it comes to different demographics.
Yep, you're right. Yep. Any questions on rewards, recognition, or advancements?
Yeah, I agree with what Ruth said. It all starts with equity. And so I'm not shocked by that first number in academia, 58% of people of color. I mean, I'm not shocked at all because studies after studies have always shown that. And so these are areas that we have to improve upon. And these are hard data to say that there is a problem.
Well, the under academia, subset of students, the second line there, that really surprised me. I just thought 94% of the white students felt like they could advance, but only 65% of the students of color felt like they couldn't advance.
I still think that number 65 is a little bit higher than what I thought it would have been.
Really?
Yeah, because when we had our, this is the one thing that I've noticed, and I always bring this to the attention when we talk about surveys. And so a lot of times students of colors in surveys, they answer the question to the best, very favorably is what I'm trying to say. They're not as honest in the surveys as they could be, because during our first town hall with NOSA students, we heard a lot of issues, but yet when you look at the surveys that have been done for students, it really isn't an issue per se. It's a little bit better than what the students kind of said. So I think a lot of times, again, it's feeling comfortable, feeling a sense of belonging, a feeling a sense of inclusiveness. And so therefore they feel that the surveys aren't really anonymous, that it may come back on them and they may get punished in some sort of way for their honesty. And unfortunately that exists. And that's why sometimes these surveys may be artificially higher in the results. That's why I was a little surprised. And what I have been hearing the students' concerns have been. And I'm glad that we're all working together. I know we're talking about the next steps in the next few minutes. But one of the things that I am pleased about as president of the NOA, and the NOA is pleased about, is that now we're really working together. All the organizations are collaboratively addressing these issues, which is something we should have been doing, but I'm glad that we're doing it now, because then maybe these students can truly be their authentic self and really answer the surveys a little bit better, so we can truly address the issues instead of them feeling that way graduating and then feeling that way once they graduate, like they never really truly were. I'm glad to get away from that place. Is what they say.
Well, in the interest of time, because I know we're running up against the hour, the next thing that we wanted to share with the group is that the various organizations and what they are doing. I've already talked to you about what the Vision Council plans to do.
Dr. Ardis, I'm sorry, before you go, Jackie Grove, the Senior Vice President of Diversity and Inclusion from National Vision, she said she wanted to address corporate optometry, what NVIs. I'm gonna go ahead and unmute.
Oh yeah, please do. Please
Jackie.
do. Thank you, Jackie.
Sorry, I muted you again. There you go.
Yeah, no problem. Thank you. I was actually just responding to the question someone asked. What does the corporate entities think about the survey results? And I would just like to comment on what we're looking at here, where it says 58% of the respondents personally feel like I have the ability to advance my career within the industry. As it pertains to that, I mean, one of the things that just would share that we're looking at is building a succession planning process in our company. Oftentimes, I think if you don't have a formal process in terms of how you evaluate your current talent, and then how you go about developing them and identifying people for future roles, right there, you're going to open it up to the fact that most people are going to select folks who are most like them or in their circle. And if most of those people are already represented by whites, then that's probably going to be what you're going to continue to get. So as you build your succession plan process, or if you have one and you are evaluating it, you really do have to look at every single step of the process and tighten it up, looking at different diversity, equity, and inclusion aspects, from what is your rating criteria when you evaluate candidates for promotional opportunities, to how are you educating the people who are doing the evaluating around things like unconscious bias and other DEI educational components. Because if the person evaluating has those types of blind spots, then that's going to occur. So really do have to look at every step of the way and tighten that process and really look at it objectively as an organization, and be able to like put the mirror to your face and say, you know what, we can improve in that area, and that might be what's causing our lack of advancement to occur. And Manuel, at one of the last conferences, Manuel Osho, he has that phrase, if you see it, you can be it. And that's really important, because if, minority, BIPOCs, women, LGBTQ+, if they do not see people represented like them in the upper echelons of the company, they're already going to feel like they don't have the opportunity to move up.
Excellent. Thank you for chiming in. I really appreciate that. And it's good to hear that NVI is making some strides in this area. And we'd be happy to sit down with Reed and your organization and share more in-depth information with you regarding corporate optometry, because it's a lot more in detail than what we shared in the slide. So we'd love to sit down with you guys, okay? Love it. It's powerful. So I want to ask some folks to dance. So in conclusion, guys, if you would, we'll go around the room real quick if you guys can share maybe the high level what you guys are doing at your organizations in regards to DE&I. So we'll start with you, Dr. Reynolds. I guess you're representing Academy.
And well, I'm representing the membership pillar for Academy, but Dr. Hurd is really our diversity task force here.
So you're NOA.
I'm representing the NOA, and I will tell you the NOA will continue, again, over 50 years of fighting this scholarship for our students, supporting our NOSA students. I think that the students are very, very important. Mentorship is very important. We've added more mentorship categories. And I think the biggest thing I just want to say on behalf of the NOA is thank you to all the other organizations for partnering in this very important issue. You know, as I said with ASCO, the committee that Dr. Shoge sits on was started by Dr. Ed Marshall, who's on this call right now, who was past NOA president. We've been present fighting this fight, and we're so happy to have others fight with us, and hopefully we can, not this one time in time, but continue on this, because again, diversity, inclusion, equity is not a sprint, it's a marathon, and we're all here in this marathon together. Thank you.
Thank you, Dr. Reynolds. Dr. Hurd.
Thank you. The Academy Diversity Task Force is very eager to make sure that there are opportunities available so that individuals of color can move up through the volunteer structure, because those can lead to really big things for people in situations. We also want to be able to bring opportunities to students as well as minority optometrists. For example, being able to provide funding for someone to have a seed grant in order to start their research. And then once they do a pilot study, maybe they will get more funding from someone else to keep it going. So, so the Academy is very open to all of that. Plus, the Academy is looking at revamping the leadership course that it's been implementing for many years. And the Diversity Task Force is going to be, is also being asked to help them implement some changes so that we can get more diversity, equity, and inclusion there.
Great, thank you. Dr. Shoge.
So ASCO is doing a few things for the Diversity Cultural Competency Committee. We are going to be relaunching our cultural competency workshop, which is available to all the schools. And it's something that most schools have gone through at least one training, but again, we need to keep current. And so we're going to be offering a virtual platform for that, as well as in-person training when that gets up and running, because the best way to implement this is to actually give people some skills and some knowledge in order to turn around then and teach their students and to ultimately affect patient care. We're also looking to making sure that this stays a part of the narrative and part of the conversation, and this is not just a one and done. And so we want to make sure that, you know, even at the school level, that this is part of what is required or what is expected for the school in terms of educating their students. So diversity and cultural competency is as expected and as an expected part of the curriculum as learning about the cornea. It just, you know, it should be that natural and should be an obvious part of the curriculum. And then making sure that when we graduate, we keep up our skills, just like we have to take continuing education to practice. We have continuing education when it comes to cultural competency. So those are some of the major initiatives that we're working on. And part of what Dr. Hurd said, the FLAM Leadership Academy, a part of Academy, making sure you identify those leaders and making sure they're getting the mentorship and the training that they need to be able to move up into these processes. So I'm happy to be a part of that, and we'll be tapping people on the shoulder, as you should be, recommending them for this Leadership Academy so that they start to get into the fold.
Thank you, Dr. Shoge. And Cristina, Essilor?
Sure. So, you know, I think echoing a lot of the comments here, really trying to continue to advance and get specific about the progress we want to make so that it's measurable and we hold ourselves accountable. But on the inclusion front, we've got two distinct areas of focus of embedding inclusion, that's in making sure that everybody, including leaders, are equipped with the behaviors that drive inclusive environments and workplaces, that our talent processes are inclusive and de-biased. Driving connection and ensuring that our employees have the opportunity to connect with each other within and outside of the industry to drive that development and network. And from the diversity standpoint, celebrating our diversity. I think we overlook sometimes the importance of recognizing, valuing, and celebrating all the diversity that we do have, making that a focus, and then strengthening representation, really addressing those drivers that I mentioned, holding ourselves accountable to close any gaps that we see in disparities when it comes to recruiting, retaining, advancing, and developing talent. But I think the headline is to basically take all the values that we have and live them in the same way we would a business objective, measurably, with accountability, and making sure that everybody is a part of driving that ultimate goal that we have as a corporation.
Love it, making a business objective. Thank you. Absolutely. And Dr. Canto-Sims and Terrence, I know we've covered what the Vision Council plans to do, but you guys want to add something before we close? Did you?
I just want to say I'm here if anyone wants to talk to me on how they can help corporate or private, all the organizations, so that we could be more diverse and inclusive, because I'm very passionate about it and I'm here. So if Terrence, if you want to give them my info, I am open to hearing all suggestions.
Excellent, excellent.
And Dr. Ardis, I wanted to bring up some things happening at Vision Expo around diversity, equity, and inclusion.
Yeah.
One thing in our speaker program, we have brought in 4 new speakers that are persons of color, 3 of which are on the call today. So please support our CE program in June at Vision Expo East. Dr. Reynolds will be leading a lecture. Dr. Artis will be leading a lecture. Dr. Chandra Mickles is on the call. She will be there as well. And Dr. Hector Santiago will also be leading a lecture. His lecture will be how to serve the needs of your Latinx patients. So that will all be within our CE COPE-approved program. We have 3 panels going to be delivered at Vision Expo. One will be moderated by our very own Dr. Diana Canto-Sims about breaking the barriers of multicultural patients. And we have a few doctors on there, as well as transitions, who will also be presenting in that panel as well. We have another panel about preparing for a more inclusive workspace. And so nice to have, again, Jackie Grove from NVI on that panel, Martin Davenport from VSP, and hopefully some other, who are all chief diversity officers at their organizations. They'll be led by Dr. Danielle Richardson, who's also an NOA member. And I think that they were most excited about, and I wouldn't say just excited, I think we're lucky, is to be partnering with the NOA and to have the NOA having their regional meeting, who will be co-located at Vision Expo East in Orlando. So honestly, to be partnering with an organization with such a history, a rich history, and moving this industry forward, Dr. Reynolds, thank you. And we're just lucky to have you guys with us.
Well, thank you for inviting us to the party. And so we can dance now. Thank you.
You are the party, Dr. Reynolds.
Oh, thank you.
So let's dance. Again, thank you to all the panelists. Great job. All of you, great job. Really appreciate it. And thank you to the audience for attending. And we're going to keep moving, and it's a journey. We're on a journey, but we're committed to this, and we're going to keep moving this forward. So thank you to everyone that was involved.